Exciting new poll in the Democratic primary in Iowa. Not overall the race, I'm going to do that in another video. Let's speak specifically about healthcare today. Look at this. You're seeing January 15th to 20th, the most recent polling period, and this was done by CNN, compared to the end of November into December, and then an earlier period. So you have a pretty big gap there between the first column and then the column to the right. And you're seeing a pretty gigantic turnaround. Bernie Sanders going from 31% to 51% on who is judged to be best on healthcare issues, and Clinton falling from 63% to 45%. Now, there's other numbers there. I'm going to leave it up for a little bit, but this is extremely interesting because while one poll, as I always say, does not prove necessarily anything, CNN is a reputable outfit, and I would imagine that polling people on who they prefer in a particular issue is probably a closer representation of what they really think than polling them on who they're going to vote for someday, especially in a primary, especially as ads are just starting to run, and especially as with one of the candidates, Bernie Sanders, they didn't really know him that well up until very recently. And I believe that that's probably a good portion of why we're seeing this massive shift of him gaining 20 points, Hillary losing 18 points. Feel free to check that math because I'm horrible at it. But that's a pretty massive shift in 2 months, less than 2 months. And understand, of course, that if this last period was January 15th to the 20th, we're talking about a small part of after Bernie Sanders at the last debate on Sunday, expressed his views on healthcare and on the need for single payer and how he would go about making that happen, but much more importantly, laying out the moral and ideological case for why that's something we should prioritize as a society. Now, you don't have to believe that his plan is the right way to do it, or even that we should necessarily do it, or certainly that we can do it were Bernie Sanders even to become the nominee or the president. But we have primaries for a reason, and it's supposed to be to not simply choose, well, who's the highest profile person in our party this cycle? Let's make them the nominee. No, we're supposed to have an open debate of ideas before the general election. This is a different thing. And this is exactly the sort of debate that we're seeing in healthcare on the Democratic side right now. And while Hillary Clinton, overall, I'm sure she wants on some level very similar things to what Bernie Sanders wants, are they going to fight for it? Well, that's where you really start to see the differences. And I think that while Hillary Clinton speaks forcefully from a progressive point of view on a number of different issues that I can and have listed in a number of other videos, police reform, women's rights, and all those sorts of things, when it comes to healthcare, she starts speaking and it's pragmatism, 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 which is perfectly fine, and that's a part of the discussion, but this is a primary, and Bernie Sanders speaks about the moral imperative that we have to make sure that people who are suffering and in some cases dying because of how expensive healthcare is and how up until very recently they couldn't even get the insurance, they need to be protected, and the health insurance programs need to be strengthened, and while we've made massive strides in terms of closing down the number of people who don't have access to health insurance, which is at effectively an all-time low, there's still millions of people who don't have it. And so he's been speaking about that, and that's one of the issues he's most outspoken on. At the debate, you saw the anger inside of him when he was speaking about the current system, even after the reforms of the Obama presidency, and that is having an effect on people. Now, of course, at the same time, they're just getting to know him, and so he's getting some points off of that, not necessarily specifically just off of the healthcare. But this is what debates are good for, I think. This is what open discussion about these issues in a primary is good for, and that's probably why the DNC doesn't want more of them. Anyway, I'm very excited about this, regardless of who ends up being the nominee, having this discussion, whether in the Democratic side or some form of it in the Republican side, is extremely important. That's a part of American democracy, and so I'm glad to see it playing out day by day.